So we will explain the concept of a hybrid OR. We will detail the different types of radiology and fluoroscopy equipment that is used in the operating room, and we will compare staff radiation exposure that's related to each type of procedure. Let's start by defining the principle of a hybrid operating room. A hybrid operating room is a surgical theater that's equipped with medical imaging systems, and it is staffed with combined medical imaging and surgical teams, creating a surgical workspace that enables more complex and advanced surgical procedures than the traditional operating room allows for, as well as enabling the replacement of a number of open surgeries with minimally invasive procedures. Over the last 2 decades, hybrid operating rooms have become the gold standard for conducting minimally invasive cardiovascular procedures, and their use is expanding into other specialties. There is no regulation or standard for what equipment is included in a hybrid OR. Individual facilities determines the use of the room and to what procedures it will be dedicated, and they design them accordingly. Surgical equipment such as multifunctional tables, instruments, surgical booms, and operating lights are included, along with the advanced imaging systems that would enable the sorts of image-guided surgical procedures for which the room is intended, such as fixed C-arms, CT scanners, and or maybe MRI machines. These image-guided surgeries require the preparation of proper radiation safety protocols to protect the medical radiographer, the rest of the OR staff, and the patient from radiation exposure. Now that we know what a hybrid OR is, let us take a look at the different types of radiography and fluoroscopy equipment that is used in the operating room. Radiography and fluoroscopy equipment used in the OR can be either fixed or mobile. Fixed equipment is permanently installed in the operating room. It is fixed to either the floor or to the ceiling, while mobile equipment can be used in different departments, such as the intensive care units. The decision for which equipment is stationary or mobile is determined during the planning and design of the hybrid operating room, and this is based on the number of factors, including the size of the room. The Facility Guidelines Institute requires that there be at least 600 square feet of open floor space in hybrid ORs. So let's talk about fixed equipment first. There are 2 types of fixed equipment that can be found. The categorization depends on the position of the X-ray tube and the detector in relation to the operating room table. They are called over-couch and under-couch systems. The over-couch configuration consists of an X-ray tube installed over the operating room table. In this case, the detector is under the table and facing the tube. The undercouch configuration consists of an X-ray tube installed under the OR table, and in this case, the detector is over the table, again facing the tube. These two systems differ most in terms of radiation exposure to the operating room staff, namely which part of the body receives the greatest exposure as a result of the positioning of the X-ray tube. Over-couch systems may expose OR staff to higher radiation doses than under-couch configurations. Radiologic technologists working in the operating rooms that use mobile radiography equipment have special radiation safety precautions that they must take into consideration. This is because compared imaging departments, ORs are not typically as well designed for radiation safety. So it is your responsibility as the medical imaging professional to ensure that proper radiation safety measures are taken and practices are followed in a hybrid OR. And last but not least comes mobile fluoroscopy equipment, such as a C-arm. Portable fluoroscopy imaging is possible in the operating room thanks to mobile CR units. So, because of their curved arm in the shape of a letter C, they are named such. On the upper arm of the C is the X-ray tube, and on the lower arm, the image intensifier. These C-arms can be used for static radiography studies as well as fluoroscopy studies. Newer mobile CR models include a host of features that are aimed at improving image quality and reducing patient radiation dose. These features include artificial intelligence, laser aiming guidance, three-dimensional mapping and navigation, and among others. These features include artificial intelligence, laser aiming guidance, three-dimensional mapping and navigation support, among others. Philips' new Zentashan mobile C-arm systems, announced in January of 2022, includes both cloud-based artificial intelligence and three-dimensional mapping, a combination that Philips states will cut radiation exposure in half and reduce procedure time by 20% or more. Now that we know the different types of imaging equipment that can be found in an operating room, let's take a look and compare staff radiation exposure that's related to each of these types. Staff radiation exposure is actually higher when using mobile C-arm units and fixed over-couch X-ray systems than it is when using fixed under-couch X-ray systems. Here we can see on this bar chart the radiation exposure and the differences in the levels. The red is a mobile C-arm. The middle one is the fixed over the couch X-ray. And the light tan is the radiation exposure of a fixed under couch X-ray.